Ladies, you know how to cleanse your face like a pro, but do you really know how to take care of your skin? Well, down there? Yes, I'm talking about your vulvar skin, the skin below the belt where the sun don't shine, the skin that we're really too embarrassed to talk about. Even as a midlife woman and a doctor, it still can feel super uncomfortable having this conversation. So I get it. And as women, we feel a lot of shame around whether our skin is normal, whether it looks normal, does it smell normal, how should we be taking care of it after having a baby, what's normal, what's not, and then perimenopause and menopause, we're seeing skin changes down there as well. I'm Dr. Marios Mina. Welcome to the Skin Reel. On this week's episode, I am joined by urogynecologist Dr. Nabila Noor. She's a double board certified expert and high volume surgeon and leader in women's pelvic health. And she has this amazing YouTube channel where she is helping spread women's urogynecologic health, not only here in the US, but worldwide, where it can be especially taboo in certain cultures in certain parts of the world, even more so than it is here. If you are wondering about skincare down there, maybe you're just too embarrassed to talk about it or bring it up with your doctor, you are definitely going to want to listen to this episode. Dr. Noor, I am so excited to have you on. You are just putting out some amazing content on YouTube. I love watching your content and learning. I'm always learning stuff. So thank you so much for being here because we are going to be talking about the skin down there, right? Like the skin where the sun don't shine, not really an area people feel comfortable talking about. Am I right?
Oh, absolutely. And, thank you so much for having me. I'm actually really looking forward to our conversation. And like you said, we think about skin, we always think about the face, not even the body, and forget what's really down there, which is kind of the world I live in. So I'm actually really excited to talk about this because, there's so much misinformation, there's so much shame really, and so much fear factor that goes on when we think about the skin down there, as we'll talk about. So yeah, let's do it.
Let's break it down. Let's talk about the skin. And we'll use like the terms that people may not even be familiar with, like your vulvar skin. Where is that?
Well, that's a great place to start because I think, a lot of the times, because I see it amongst my patients, it's, when they talk about the vagina, what they're really referring to is vulva. And what you'll be amazed, and I'm sure it's not unheard of, there is a difference between the vulva and the vagina. So to put it in simple terms, what we're looking at externally, that's the vulva. So the vulva is the external female genitalia. So that includes your mons, it includes your labia majora, which is that thick skin fold that we have. The vagina is internal. So we don't really see the vagina. What we do see is the external, the vaginal opening. And, that's basically where, when you're having a baby, when you're having a vaginal birth, that's where the baby comes out from. And of course, like, every month when women are having their periods, that's where the blood exits. So again, when we're talking about the vulva, we're talking about the skin outside, which is very different from the vaginal tissue, which is an internal tissue.
Right. Yeah. It's so funny because everyone will just say vagina and they mean the outside skin. But it's like saying, I have a baby in my tummy. It's like, well, you don't really. The baby's not in your tummy, but no one says I have a baby in my uterus, right?
That's a good analogy. I didn't think about that, but yeah, you're absolutely right.
So we talk about, I'm a dermatologist. We talk about skincare. I joke that people just think skincare involves your face. Like they forget they have skin everywhere else on their body. But is the vulvar skin really different? And if so, how?
Yeah, no, that's a great question. The vulvar skin is more gentle, right, than the regular skin. It is more sensitive, which is why, it has a lot more nerve endings. It is different than the skin when we think about our hand. So it doesn't wear and tear as well as the rest of your body. And also for most of the time it's hidden, right? So it's not exposed to the outside as much. So, things that we can put on our face, whether it be, chemicals or some of the, harder soaps or detergents, whatever it is that we use, may not always be the best thing to use for that vulvar area, and definitely not the vagina, because like I said, that's more internal. One thing that I always tell my patients is, especially when they ask me about hygiene or like, what to apply, Because some of the common things we hear about all the time is, scented soaps and everybody is like douching. And because somehow we have this narrative that things are supposed to smell like a flower garden down there or whatever other fragrance you prefer. And I get it, like, women are conscious because that's how unfortunately society has trained us to believe. And there's a lot of shame goes in for I see it with my patients all the time that, oh, I don't smell well down there, or I don't smell, the way I'm supposed to be. The question is, who knows how you're supposed to smell down there? So that's where it gets a little tricky because I see my patients using all sorts of chemicals that's really not meant for that particular area of the body.
Yeah, and I can only imagine, right, that mucosal skin, that skin that's not dry like the top of your arms is super, super delicate. And yeah, this is why I'm not a fan of fragrance in skincare products. And I know a lot of my pediatric dermatology colleagues that they always talk about like baby skin. Like there's so many baby products that have fragrances, and we're like, your baby's not meant to smell like lavender, and baby skin is very delicate and gentle, just like that vulvar skin, right? So
Yeah, and actually, to your point, that's what I tell my patients exactly. When they tell me or ask me, okay, so what can I apply there, right? If they're having a lot of dryness or itching, or, they're having like sensitivity. So the simple way to think about it, something that's safe for your baby's diaper area is probably safe for mommy as well. And, when you think about, whether it's like petroleum jelly or like a gentle coconut oil or, Destin cream, if you're getting a lot of rash, something that you can put on the baby that should be safe for adults as well. And I think another thing to think about is that, one of my pet peeves is, it's great to be like, in like tight leggings. We all love, good fitted clothes. But again, if you're somebody who has very sensitive vulvar skin and, you're prone to getting a lot of infections and irritation, something to think about is what kind of material you are touching against that area. So, synthetic material, tight leggings, those, if you're wearing it all day, every day, it traps a lot of heat and moisture, and then that can cause harm to that space as well.
yeah, and how would you know if it's harmful? Is it just that you're having irritation, or is there odor? Like, what are some of the signs? Like, oh, I need to.
Yeah, so, usually, I obviously am seeing patients who are having problems, right? I have a lot of women who can get a lot of irritation, a lot of itching, a lot of pruritus in that space. And the common thing that they're always treated for is a fungal infection. And yes, sometimes it could be a fungal infection, but very often it's not, right? So to just assume that it's a fungal infection and treat yourself, because I see a lot of women self treating themselves, they'll pick up something from the store over the counter and just apply it. And then over time, they're like, "Oh, I'm getting fungal infections like every few weeks." And by the time they come to see me, we realize the diagnosis is completely different. So to going back to your question, if you are getting a lot of infections, a lot of itching, and that area just create gets a lot of moisture, which can cause fungal infections, then think about it's not always just a hygiene issue. It could also be the products that you're using. It could be the clothing that you're using. Are you kind of letting it air out, right? I mean, yes, you're wearing underwear when you're going outside, but when you're at home, I mean, let that area, you don't have to wear an underwear 24/7. Just let that area kind of air dry so that the moisture can leave.
Yeah, so probably wearing like your bathing suit all day, every day is not a great idea.
Yeah, now that we're in the summer, right? Yes, exactly. And again, be sensitive too. Like if you see certain changes in your body because, maybe you're using a new detergent or you just change your bed sheets, just try to connect the dots to see if something makes sense. I think a lot of women get really honed in on the hygiene issue. And yes, for some women, it may be a problem. But I'll tell you that majority of my patients, I mean, these are some of the patients who are so obsessed that I feel like sometimes they overtreat that area. They're scrubbing, they're using soaps, they're so paranoid, and that, in fact, is probably causing some of the issues that they're having.
Oh, we see this in dermatology, things like acne, and I'm guilty of it. When I was a teenager, I thought if I could just like rip the top layers of my skin off, I would clear my acne, and I was just damaging it and so aggressive with it. And spoiler alert, it did not help it, right? And so I can totally see that this sort of like compulsive. I got to clean it more. I got to clean it better, and then you're really, really irritating it and just making it worse. So what do you recommend, cleansing wise? Can you just use your regular cleanser in the shower? Does it need something special? What's your best recommendation?
Yeah, honestly, like, especially for the vulvar and vaginal area, I always say less is more, right? Water, best thing possible. If you're somebody who is conscious about how you smell down there, especially after, say, maybe you urinated or had a bowel movement, just use water to clean down there. And then, maybe just pat that area dry afterwards. Definitely nothing scented. Definitely no douching. That's a big no-no, especially if you're somebody who's prone to getting vaginal infections, things like BV or even yeast infection. I do recommend using cotton underwear whenever possible. Every now and then you're wearing a nice tight pants going out, okay, but don't wear it 24/7, especially if you have sensitive skin. And again, like be conscious, right? If it was a new, like I said before, if it was a new soap that maybe you used or a new bed sheet or a new kind of material that you're wearing, if you're using some of these basic things and things are still not improving, that's a sign that you need to be evaluated. Because, like we mentioned before, it could be something completely different. I mean, there are pathologies that can cause some of the same symptoms that sometimes we may just think, oh, it's just skin irritation. Oh, it's just fungal infection. There are things like lichen sclerosis. There's things like eczema, like irritation. I am, of course, a urogynecologist. I see a lot of women who suffer with things like urinary incontinence where they're leaking urine. So they're wearing a pad 24/7. And again, it may sound silly, but there is a difference between pads that we wear for our menses or our period versus pads that you wear for incontinence, right? And a lot of the time, especially my young moms, if they're just having a little bit of leakage here and there, and they already have a sanitary pad at home, they just use it. But remember, that's meant for blood, which is a very different material than urine. And sometimes, it doesn't work the same way. And then the moisture doesn't completely dry up. And then that is also causing irritation for their skin. So there's so much stuff that can happen, not to mention women who have problems with their bowel movement or their stool that's staining. So there's a lot of things that can cause irritation in that area that needs to be evaluated.
Yeah, I totally never thought of it that way about the incontinence. Like if you're having a little leakage, maybe after a baby or you're older, I would have just said, yeah, get a sanitary pad. But you're totally right. Like urine and blood, very different substances. But as you were talking, I was kind of thinking of like the advice I would give a parent of a newborn or a baby. And they're struggling with diaper rash, right? And the reason babies get that is because of irritation. Maybe the wipes are too irritating or the soaps that are being used. And so we'll tell parents just to splash with water to let the baby air out, like not wear the diaper for a little bit of time so that that skin has time to breathe. So it's I can see the similarities, right, for women too.
Absolutely. And wipes come up all the time. Patients will always tell me, "Oh, I use wipes." And that's fine. Wipes are great. Again, if it's gentle, it's totally fine. But again, depending on what kind of wipes you're using, if you're trying to use a scented wipe, know that there are going to be chemicals over there, right? So if you're kind of using the wipe, and again, like I said, a lot of my patients are having issues with incontinence or maybe bowel issues. And again, they're being very aggressive and they're really kind of rubbing that area, which can cause irritation. And then, put some chemicals on it, it can get worse. So again, I'm a big proponent of just using water. A lot of people are now considering bidet in their bathrooms. If not, I tell women, like especially those who are prone to these infections, carry a squeezy bottle. Go to a dollar store, get a squeezy bottle. It's very cheap. Because you can even carry it in your purse. Even if you're in a public restroom, just fill it up with some water, take it with you in the room, just splash that area, and then just pat it dry. Easy peasy. And again, there's nothing to be embarrassed about it. You want to do what's best for your health.
Right. Absolutely. Those wipes for sure have fragrances. Yeah, even for like your babies, right? Like just water is the best. And yeah, I feel like those Europeans really were onto something with the bidets. So I am starting to see those more and more. So maybe that will.
I will tell you, I'm South Asian. I mean, hey, water is the way we clean down there. So
Is it? Okay. All right. We're the US is just like needs to catch up, huh? Well, what about lotions? Because I do see some beauty products and lotions being targeted to the female air genitalia. And I feel like again, as women, we are constantly being told like now we've got to worry about this body part and now this isn't right. You got to fix this. So are these creams and moisturizers, are there any benefit to them? Would you ever recommend them?
yeah, you have to think about why you're trying to get it, right? If it's because of dryness and irritation, honestly, the best thing to use is like petroleum jelly or like a light oil. Coconut oil is great, right? Petroleum jelly, some people may not like it because it's very viscous and thick. So coconut oil is great. I mean, coconut oil, you can literally use it externally on the vulva. And even for a lot of women who suffer with vaginal dryness and cannot do any hormones, we even recommend they use it for internal use, almost as a lubricant. So coconut oil, 100% organic, is my go-to for anybody who is worried about dryness, irritation, and almost want as a barrier. Now, if you're getting rashes, like we talked about, right? If we put Desitin cream on kids, anything with a zinc-based paste, that's great for older women too, or even, like adults as well. So you have to kind of think about why you need those moisturizers. So if you're thinking about the dryness, we talked about Aquaphor, petroleum jelly, coconut oil. If you're wanting to do it because you think like you're supposed to smell there a certain way, like we talked about, really not something that we would recommend. And you and I both know, right? I mean, like the whole marketing industry, they play on women's insecurities. And this is an area, I mean, you see it in your world, and I definitely see it in my world. This is an area we don't talk about enough, right? I mean, I have educated women who are and any other aspects of their life, like very high functional, won't believe anything unless they've read about it. But when it comes to that sensitive part of the body, women, all of us get very conscious. And actually, like, a lot of women are ashamed of even discussing it or even bringing it up with their primary care doctor or even their OBGYN. So a lot of the times I will bring it up. Like it's crazy to me, somebody's coming to see me for incontinence and I'm looking at their vulva and I can obviously see there is like signs of lichen sclerosis. And then I'll ask them, they'll be like, "Oh no, it just itches." And no, she didn't even think this was something to talk about. She just assumed that this was normal. This was a normal part of aging. I mean, not to mention a lot of women who after menopause are now dealing with dryness, irritation, pain with sex, and they just assume that this is normal part of aging. It is common. It's definitely not normal. So I think we really have to be, especially those of us in the field, or even as physicians, or even as women, right? We really have to change the narrative that there's a particular beauty standards for the vulva or the vagina that we're aiming towards. I see it in the surgical specialty too. I see many young women, especially now that, we live in the social media world, who are so conscious about the size of their labia minora and their labia majora, and they want to get labiaplasty. And I'm like, first of all, who decides what's the normal size of labia minora? I know it's a whole different topic, but it comes up. Like, it's that whole, beauty standards of, like, I'm sure you see, like, when we're talking about fillers, yes, they can all help. But, it's that really like sensitive line of, okay, I'm doing it to improve my confidence versus now I'm kind of running into a little bit of body dysmorphic disorder.
Right. Exactly. Yeah. It's like, okay, yeah, now women need to feel insecure about what their labia minora looks like or their labia majora. It's like, when is this going to stop? I joke, like, I go to these conferences and I'm like, oh my gosh, now I got to worry about my elbows and now I got to worry about my vulva. Yeah, it is unfortunate because I just don't see men sitting around stressing out about their scrotal skin and all of that, right? And so right, and I'm with you, I've seen women with lichen sclerosis, extra mammary patches disease, which can also occur in that area, and I'm shocked how the woman will have just been suffering for months and years.
Yeah, I mean, I see things like vulvar cancers, right, or vaginal cancers that, women just assume that, oh, it was a blister, it's not a big deal. Or maybe I just kind of, itched that area a little too much, it scratched, and then we biopsy it, and lo and behold, it's cancer. So, yes, you want to be aware of what's happening down there, but for the right reasons. And then, listen, I completely get it. I hear it all day, every day. Like, like simple things, how when we're going for GYN exams, like the amount of time I hear, "Oh, I'm so sorry, I didn't shave down there." I'm like, "I don't care. Please don't even worry about it." Like, it's so funny to me. And I'm sure I probably do it too. Like it's just so subconsciously inbuilt in our head that, oh my God, like, I'm not supposed to have any hair down there. Oh, it's supposed to look like all nice and tight in a certain shape and size and smell a certain way. So I think again, what scares me sometimes is that yes, you don't want to miss pathology, but especially in the world that we live in where social media is everywhere, as like, as those of us, kind of maturing and even the younger generation as they grow up, like they shouldn't think that there is a certain standard that I'm striving to. That's where it can get really scary.
Yeah, absolutely. Now, a lot of my listeners are women in midlife. They've had children. Let's talk a little bit about like postpartum issues that come up. Because again, I feel like this is something that is really not talked about. It's kind of taboo. They might say, "Oh my gosh, I had an episiotomy," or "I needed this many stitches," and we don't really. I feel like address this openly and talk about it. So, what are some of the skin changes that can happen after having a baby?
Yeah, I mean, that's a great point because, a lot of that self consciousness starts from that period, right? Again, depending on whether you've had a vaginal delivery or a cesarean section, things will be different. Now, when, women is having vaginal delivery, I mean, remember what you just did. You just delivered a 6 to 9 pound baby. So there's a lot of stretching and tearing that can happen because this baby has to pass through that vaginal canal. Most commonly we see vaginal lacerations, right? So there's first degree to fourth degree lacerations. I know most women who've had vaginal delivery will have a first degree or second degree laceration. The vaginal skin tears a little bit, maybe a little bit of the muscle underneath. But when you're going into more third degree and fourth degree, that's where, we're going into that rectal sphincter, and worse situation where you literally have a tear starting from the vaginal opening to the rectal opening. Now, if you're in the United States and in most developed countries, most people are delivering in the hospital under the guidance of a physician or a midwife, and they're pretty well trained to repair that area. But every now and then, again, in my world, I see somebody's repair breaking down and then that whole area just kind of opening up. And you can imagine how traumatizing it is for a new mom who now not only has to deal with all the postpartum hormonal, psychological issues, she has a new baby, she's sleep deprived, and now she has to deal with this painful situation. So episiotomy is another thing that sometimes, the physician community or the midwife community will do, which is basically as a separate, like a surgical incision that we make to enable the baby to come out. Thankfully, we're going away from it more and more because there's very good literature in my world, in the urogynecology world, that shows when we're cutting into that area, that's actually causing more damage to those muscles. Like even a few, like 10, 15 years ago, we used to do it routinely on every woman. So my mom's generation, it was so common. Thankfully, that's changing. But what really happens, even if somebody didn't have a lot of tear, is there's a lot of vaginal laxity that can happen. And also remember the hormonal changes that your body goes through, especially if you're thinking about breastfeeding or you're planning to breastfeed. So when you're breastfeeding, the estrogen level in the vaginal tissue decreases, and your tissue almost, or your vaginal tissue almost mimics that of a menopausal woman. So we have a terminology for that. We say genitourinary syndrome of menopause, and then there's the genitourinary syndrome of lactation. So a postpartum mom who is breastfeeding her baby, her vaginal tissue and how she feels down there almost mimics that of a menopausal woman. Now, it may sound scary, which it is, but the good thing is it reverses. All this to say that immediately after you've had a baby, and almost like for a good few months, things will not feel the same. And I see women in my office because, they're so upset and worried that, everything feels like, like nothing feels the same. A lot of women may notice something called pelvic organ prolapse, where their pelvic organs, which could be the uterus, the bladder, the rectum, are pushing through because everything is just wide open. A lot of moms can notice urinary leakage. Like I said, the good thing is a lot of it can be reversed with conservative measures. So a lot of my work with this population or this patient population is reassuring them that this is temporary. With the right treatment, with the right guidance, things will improve, but it may take some time. And I think the key thing is to be patient and not lose hope.
Yeah. So what are some of those measures that you can do?
Yeah. So definitely somebody who's maybe not done with childbearing, right? Or maybe considering a second or a third child, we're not going to be doing something surgical. So we focus on more lifestyle changes. We focus on kind of avoiding risk factors. Now, what do I mean by that? The first thing is strengthening your pelvic floor. Now, pelvic floor is basically the floor of our body that's holding all our pelvic organs, which could be the uterus, the bladder, the rectum, the intestines. And so those pelvic floor, I mean, imagine what just happened. You just carried this baby for 9 months, and a lot of women are constipated during pregnancy. So there's a lot of pressure that happens on that pelvic floor, not to mention the whole process of vaginal delivery can cause a lot of damage to the nerves and muscles. So the first important thing is to learn how to strengthen those muscles. Many of your audience may have heard about Kegel exercises. So we start with Kegel exercises, which is a special kind of Kegel or exercises to help strengthen your pelvic floor muscles. But the important thing to know, it's not just your pelvic floor muscles. You need to focus on core strength. You need to focus on your hips, body alignment. I mean, think about, all of a sudden, all you're doing is just carrying heavy things because those baby strollers, those baby carriers, you're holding a baby all the time, breastfeeding. I mean, your life is completely changed. I probably convince some of your audiences who are thinking about pregnancy to be like, no, this is a bad idea.
They just called in for a refill of their birth control.
They're like, yes, let's get that IUD in. But jokes aside, so there's a lot of changes that happens and we may not realize it. So focusing on kind of body mechanics, breathing techniques. We talked about earlier, like your vaginal tissue is very different. So a lot of women will notice dryness. So using some vaginal estrogen cream to help improve that tissue texture. So that's when I often recommend my patients to work with a pelvic floor physical therapist rather than trying to just do everything by themselves because you need that guidance. Now, of course, with a newborn, with your life just completely like disrupted, there's a lot happening, and committing to a pelvic floor physical therapist may not be the most practical option. But thankfully, there's a lot of content on social media. You mentioned earlier, I do a lot of social media posts. And the reason for that is because there's so much women can learn from the net if you know where the right sources are. I have a YouTube channel. I'm always posting on social media. And the idea is to educate women, to teach them how can they do some of these things correctly, even at home without the help. But the goal is to get into a habit, even if you're committing 5 minutes a day, just but doing it consistently the right way.
Yeah, I just remember when I had my son, he was my first. I was not prepared. I mean, it was like my life flipped upside down. I mean, of course, we were so thrilled to have him and all that, but you know your life's going to change, but then it's another thing to experience it, right?
It is. And also remember, your body, it's not just the experience because your body is going through so much hormonal ups and downs, right? I mean, think about how crazy we get every month when we're having our periods. Now, when you're pregnancy and postpartum, that's like 100 times of what happens on a monthly basis. So what you're feeling is completely real. And I think a lot of the times when I see my patients, it's very easy to feel that, oh my God, everybody had this perfect birthing experience, because on social media, you see all these perfect pictures. Maybe I'm the only one who's suffering. And I tell them the stats are so different. Like 50% of women who have had vaginal delivery will have pelvic organ prolapse. We know that. I mean, that's a fact. But do we talk about it? 1 in 3 women have urinary incontinence. Do we talk about it? We don't. So I think we just have to start having these conversations more and just this normalize this. There's no shame, there's no stigma. It's common, but that doesn't mean that you have to suffer with these. We're doing podcasts like this to educate people like these things can happen. Now, we've been focusing a lot on vaginal delivery, but with C-section, I mean, I had 2 C-sections, and yes, my pelvic floor is fine, but no, you have a major incision in your abdominal wall, which is basically cutting through your whole abdominal muscles. I remember like getting back that core strength. Like even now, I feel like, I'm still kind of working towards it. And my daughter is 3 years old. So it's not that, oh my God, forget everybody and just go get a C-section and you're saving everything. Everything has its pros and cons.
Yeah, that's major surgery. I mean, major.
That is a major abdominal surgery. And so often, I mean, think about that's a whole other topic, but we get barely 6 weeks postpartum to even recover. And you're expected to go full force. I mean, you and I know, like as physicians, I was back at 6 weeks. I mean, operating, So
Yeah, I was back at 3. But it is crazy, yeah, to think what we expect women to just like, "Okay, you've had your baby, get back to work." Because, yeah, I had 2 C-sections as well, and I just remember I couldn't sit up, if you're laying on your back, I couldn't just sit straight up for a while, so what I had to create this, like, roll off the bed onto my knees, then I would stand up, and then once I was up, I was fine, but I'm like, "This is crazy." And yes, I had to like, I was, I felt like pressure to just get back to my normal life, get back to work, get back to patients, pretend like, everything's perfect. I'm sleeping and all this stuff. And we put so much pressure on us and we feel that pressure. But it is ridiculous to think what we go through delivering a child and yet we expect people to be back within weeks.
Yeah, and I think, sometimes people forget because up until you deliver, you're the center of attention, right? Once you have the baby, all of a sudden everybody's just talking about the baby and nobody really cares about the mom anymore. And I think, what we're trying to do, and especially in my world, like a lot of the times, I'll tell all my OBGYN colleagues that if you have a mom who's suffering, refer them to me, even if I know that I'm not going to do anything. It's just me giving them that reassurance as a subspecialist that this is so common. You are not the only one who's suffering, and things will improve. So I think when they hear it from different physicians with different specialties, it's just reassuring for them. I mean, I see so many women, and I've seen family members being so upset at how their facial skin changes. Right now, they're getting acne, the hormonal changes. They're devastated. You probably see women in their perimenopause, and as me, like as we're like getting into that perimenopause phase, like all of us are scared. I mean, thankfully, we live in a world where we know more about menopause now than we ever did over the last 10 years.
Oh my gosh. And we're talking about it, right?
Yes. And, I tell all my girlfriends, I tell all my like family members, again, knowledge is power. Even if you decide I'm not going to do anything, you should know like what's normal versus not and not feel that you're isolated, like, you're struggling by yourself and you're isolated in this.
Yeah, you really hit the nail on the head where when you're pregnant, you're the center of attention and then you have the baby and it's like, make your kids stop crying and why can't you control what they're doing? And I always would laugh when I would see those like parking for pregnant women near the front, near the handicap spots. I'm like, really, the parking should be for like parents with small children because that's when it's really hard when they're no longer inside you. Um, but yes, I same thing with like menopause. Like I feel like for so long that was and for a lot of people it still is, right? Like it's a four-letter word. It's like, ooh, you don't want to be associated with menopause. Like I've asked a few of my patients if they were menopausal or not, and sometimes they'll get really offended, like, oh my gosh, no, I am not. And it's sad to that we still have that stigma, like, ooh, you're menopausal, you're old, you're not valid, you're done.
Yeah, like you're done. Your purpose in this world is done.
Exactly, exactly. Well, let's talk a little bit about like perimenopause and menopause, like, because I feel like I hear incontinence can kind of come back again, leakage, dryness. What's going on? And I imagine it's all due to the fluctuating estrogen and then sort of the decline.
Yeah, absolutely. So, I always tell that the two big events in a woman's life where you see this really, really life changing pelvic floor changes. Number one, we talked about already pregnancy and the postpartum period. And then the second one is that perimenopause menopause period, right? And the reason is, like you mentioned, your body is going through a significant amount of hormonal changes. Before we used to think like menopause happens and your ovaries just like stop producing hormones. It's just that one specific date. But now we're learning not really. Perimenopause can stretch for many women as early as in their late 30s, which means like starting from their late 30s, women can start noticing the decrease in estrogen, which can cause a lot of these symptoms that we're talking about, whether it be in the vaginal area. So, some common things that we hear about, vaginal atrophy, which means thinning, which causes vaginal dryness, pain with intercourse. There's vaginal or estrogen receptors in the bladder and the urethra. So we see a lot of urinary symptoms, things like urinary urgency, like not being able to hold the urine anymore. When they feel that urgency hits, if they don't make it to the bathroom, they're going to have an accident. The pelvic floor gets weak, so a lot of women will develop what we call stress urinary incontinence, which is leakage with laughing, coughing, sneezing. A lot of women can just have pain in general because the tissue, the vaginal tissue, doesn't have the same texture, doesn't have the same kind of rugae, and it's not as healthy as it used to be. So these are some common things that, I hear my patients complain about. Now, the thing to know is that we cannot avoid perimenopause or menopause. All of us will go through it. But what I always kind of try to emphasize is that you don't have to go into it knowing that, okay, this is it. I just have to suffer through it. You really don't, right? We have so many good options, which are very doable, very easy, cheap, conservative options. I mean, vaginal estrogen, right? You can get a tube of it for $13 with the right pharmacy. And a little bit of vaginal estrogen can do so much. I mean, earlier we talked about expensive lotions. Really, you don't need anything. If you're in the perimenopause, menopause phase, start with some vaginal estrogen. If you need hormone replacement therapy, talk to a good menopause specialist who can help you with that. But know that hormonal replacement therapy is really more for the systemic symptoms. It doesn't really do as much, maybe some, but not as much for the vulva and the vagina. And so for that, we need that local therapy. And then again, if you're suffering, go see a specialist, who can do a biopsy if needed, who can do a good exam, because a lot of the times it could be something completely different and, you're just blaming it all on menopause.
Right. Yeah, it's so good. And I think a lot of women don't even know what their anatomy looks like, right? So if you are, I mean, grab a mirror and take a look, right? If you're having some symptoms and kind of get an idea cuz I think a lot of people they'll have symptoms but they won't even take a look, right? And see what's going on.
And I think that's why, anatomy matters so much, right? Or using the right terminology. I mean, when we started the conversation, the reason we took that time to separate the vulva from the vagina is because of that, right? Because a lot of the times we don't even have the vocabulary to explain where the problem is, right? I mean, like you said, looking at the female external genitalia, you have the clitoral anatomy, you have the labia majora, the labia minora, then you have the vaginal tissue, then you have the vulva, and they're all separate anatomical entities, and you can have pathologies of each one separately. And depending on what the pathology is, the treatments are different. The identification or the diagnosis are different. So it's really, really important to understand that. And sometimes, I've had many patients that is really kind of suffering, whether maybe it's a complicated lichen sclerosis patient or a complicated lichen planus patient that I co-manage with my dermatology colleagues because I have my own experience. Maybe, somebody like with your background is a different experience. And sometimes, when we're dealing with some complicated patients, you want that multidisciplinary approach. You want to bring in pelvic floor PT. You want to bring in, maybe your endocrinologist, whoever needs to be. And I think, that's why it's so important to make sure you don't just ignore these symptoms. And if you're not satisfied with maybe an answer that you're getting from one specialist, I always tell my patients, don't feel bad about getting a second opinion. Maybe they just didn't have an experience with your kind of condition, which happens in my world. I'll tell patients sometimes, it's like, I know this is not normal. I don't know what it is. I'm going to send you to my dermatology clinic or to my dermatology colleague. And, vice versa. Like sometimes my dermatology colleagues will send patients to me and they're like, hey, I'm not really sure what it is. Can you take a look? And yeah, we work together.
Absolutely. Yep. And the first step is just having the courage to go in and get the help and realize, yeah, again, you don't have to suffer. And I love you're doing a lot of work, not, you're based in the US, right? But you are doing a lot of work globally because I do feel like as a woman in the US, like we have access and women in other parts of the world don't. And so I just think it's amazing how you are out there making this available to women all over the world, especially in cultures where it's even more stigmatized than it is here, right?
Yeah, no, absolutely. And thank you for mentioning that because I am Bangladeshi American. So I was born in Bangladesh and then I moved here for school. So on my YouTube channel, you'll see that I make videos both in English and Bengali, which is to help women who don't speak English but speak Bengali. And, to your point, the amount of questions that I get from my young postpartum moms just about, like we talked about, what's normal, what's not, the amount of fear there is, the amount of stigma there is. Like, I'll give you a few examples. Like, I have patients who are in their 20s and they just had a baby and, maybe they have a little bit of prolapse and they're so petrified that they're not going to be able to get pregnant again, which is so simple and so silly. Like, they shouldn't be thinking like that. Or, somebody who has urinary leakage and they think that, if they are intimate with their partner, that they're going to give it to their partner. Like, just it may sound silly to us, but again, all that is from, and these are all educated women. I mean, I'm not talking about women who are not educated. These are well to do, educated women. But when it comes to that vulvar skin, like we started the podcast, like skin down there, it's all a mystery, right? And if you think about it, even in healthcare, women's health really forms such a small part of what we do. And it's unfortunate, right? I mean, funding wise, I mean, we're always fighting about how much more funding we need in doing quality research about women's health and not just what we're talking about. But pregnancy, there's so many things that we still need to learn about or do better. Hopefully it's we're all in the right path. Hopefully things will change. But yes, there's a lot of progress to be made. We have come a long way, but there's still a lot of ways to go.
Yes, absolutely. Well, I mean, many thanks for you for being out there and having this platform and sharing your knowledge, right? Making this a free resource. And I'll tell you, this episode has just made me realize even more so how phenomenal women are. I mean, the things we go through, what our bodies go through, and we do it without complaining, with a smile on, looking pretty, right? Like trying to please everyone. It's really phenomenal, and it's just amazing. So our bodies are amazing. What we do, what we go through, it's really phenomenal. And yeah, I mean, there's help out there. A lot of these things are normal, and you're going to be okay. But a lot of times, you just need reassurance or guidance or just an ear to listen. And so I'm so thrilled that there are people like you out there. I've learned a ton. I mean, and I'm a doctor, right? And I've still learned a lot. So I know people are going to want to find you and follow you. Where is the best way for them to do that?
Yeah, absolutely. So, like we mentioned before, I'm pretty vocal on social media. So my YouTube channel is my main, kind of resource for everybody. It's just my name, Dr. Nabila Noor. I'm also on Instagram, TikTok, Facebook. It's all easy. It's just Dr. Nabila Noor. My webpage is drnabillanoor.com. So that has all the links. I live in Allentown, in Pennsylvania. So if you're ever in the area and you need a urogynecologist, definitely look me up.
Yeah, amazing. I will include all that in the show notes. And I so appreciate you being here. And I will see everyone next week.
Thank you so much. It was a wonderful conversation. I always learn a lot from your videos too. And I think, we're both passionate about education. That's why we do what we do. And hopefully, with all this, your audiences will learn a lot about stuff that maybe they didn't even think about and hopefully get the care that they need.
Absolutely. That's the goal, right?
That's the goal.
All right. Take care.
Bye, everyone.